Hi, my name is Pam Exaverius, and I'm an Associate Professor of Epidemiology at St. Louis University College for Public Health and Social Justice. I'm also the Director of our Maternal and Child Health program. Here at St. Louis, we're actually the only accredited School of Public Health at a Jesuit institution in the world. That's important to this project, as to be with a Jesuit university is really about serving those who are often poor and underserved. It's about being with each other. The project that we're going to present to you today is one that has focused on infant mortality in our region of the United States. Here we have some of the worst birth outcomes in the world. Oftentimes when we do analysis around infant mortality or other birth outcomes, we can look at large population level data and look at risk factors. We also many times will talk to obstetrics and gynecologists, we will talk to family practice docs, we will even go to local public health agencies to get their input on what we can do to do better at serving moms and babies. The voice that we often don't listen to is the voice of the mothers. This project is about giving voice to the voiceless. We handed cameras to moms in our communities and asked them to take pictures of why they thought too many of our babies were dying. The project our students are going to present to you today is that very project, and what we learned from the women about babies' survival in our communities. Thank you for your time, and I am excited to have two of our stellar students present our project to you.
Hello everybody, my name is Vindhya Kakarla. I'm a medical graduate currently pursuing my second year Master of Public Health in Epidemiology. My colleague Anne Niegina and I are here today to present the findings of our photo voice research titled Reality Unraveled Through Camera Lenses, where we discuss environment as a key issue surrounding infant mortality in the city of St. Louis in Missouri in the United States of America. We are affiliated with the St. Louis University College for Public Health and Social Justice, located in St. Louis in the United States. This project was guided by Dr. Pamela Exaverius, who is an associate professor in epidemiology and the director of the Maternal and Child Health Concentration at the College for Public Health. We thank you for giving us this opportunity to present our research here today. Infant mortality. It is an important indicator of overall health status of the population. The former British Prime Minister, Winston Churchill, called this a political statistic and stated that his call for statistics on infant mortality requires proof of a lower infant mortality rate during his tenure when compared to that of his predecessors. This statement explains how grave an issue this has been for decades now. So why is environment a key factor? Poverty level and socioeconomic conditions are well-known risk factors for adverse birth outcomes, and these in turn impact the structural factors that affect infant mortality. These structural risk factors are also important in evaluating the effect of neighborhood residential environment on individual health. Environmental risk factors known to increase the risk for infant mortality are neighborhood poverty, deteriorated built environment, neighborhood level unemployment, and also low access to healthcare services. So with this background on environmental impacts, let us now shift our focus to infant mortality issue in the city of St. Louis. St. Louis is one of the cities with the highest infant mortality rates in the United States, and persistent disparities exist across spatial, socioeconomic, and racial levels. The odds that an African American baby will die before the first birthday is more than twice the odds of death of a white baby during the first year of life. Other indicators for poor health conditions in St. Louis City are high crime index, low high school graduation, high unemployment rates, and also high poverty. As we can see in the graphs here, health indicators like crime index, high school graduation, and unemployment rates are pretty worse in the city of St. Louis when compared to the state of Missouri and also the national average of the United States. So, after delving into the existing literature in this area, we came across certain limitations to this, as a majority of it is based just on the census data. These may include failure to account for potential changes that take place throughout a study period or the period of data collection, and also lack of accurate measures of area level deprivation, leading to erroneous estimates of the influence of area level exposures on adverse birth outcomes. Therefore, we chose to explore the implications of environmental factors on infant mortality from the perspective of women who reside in the urban area of the city of St. Louis. We integrated the voice of these women in the efforts to reduce infant mortality and also aimed at identifying non-traditional gatekeepers and individuals from non-health sectors with a great insight into fighting the unacceptable infant mortality rates for an improved cross-sectoral partnership.
Hello, I am Anne Niyigena. I'm in my second year of the Masters of Public Health program at St. Louis University College for Public Health and Social Justice, and I am in the epidemiology track. This qualitative study was inspired by an African proverb that says, "Until the lion has his or her own storyteller, the hunter will always have the best part of the story." Our primary objective was to identify the voice and the stories of women who live the experience of infant death in the conversation around infant mortality in the city of St. Louis. We used a storytelling form of community participatory research called photo voice. What's very interesting about photo voice is that it gives people with little voice a platform to identify and understand the needs and the assets of their community through photographic images. Data is generated in the form of images, narratives, and discussions, and this data is used to mobilize action and affect the policy. The photo voice study was conducted in the city of St. Louis, the state of Missouri. We recruited a racially diverse group of 10 women who live in the urban area of the city and who have lost a baby during the first year of life. We gave participants digital camera and asked them to take pictures of aspects in their environment that they think contribute to high infant mortality in their communities. Before the actual data collection, the research team conducted 3 training sessions to discuss the concepts, ethics, and technical aspects of the photo voice methods. Photo voice procedures were guided by the showed method, defined by a set of the following 6 questions. What do you see on this image? What's really happening here? How does this situation relate to our lives? Why does it exist? How could this situation educate others in the community or policymakers? And what can we do about this problem or situation? All pictures were collected via mail or electronically uploaded to a secret Facebook page. Discussion sessions about the pictures and the narratives were held. Women assigned overarching themes to the pictures, and the research team assigned themes to the same pictures independent of themes by women. The current study focused on the theme of environment, which was the most recurrent theme according to themes assigned by women. The theme of environment was further subdivided into subthemes by women. A subtheme was approved only if it was represented by at least 4 pictures. We calculated kappa statistics to examine the extent of agreement between the subthemes assigned by women versus those assigned by researchers. 50 pictures fell under the theme of environment, and those pictures represented 6 main sub-themes, including physical environment, housing, transportation, community safety, community engagement, and economy. Kappa agreement test showed that women and researchers agreed on a sub-theme 21% of the time. We also identified 14 non-traditional gatekeepers from discussions and narratives of the pictures. Through stories and pictures, women portray their environment as the one that doesn't promote their own well-being or the well-being of their babies. Here are a few examples of photographs and narratives by sub-theme. The environment is portrayed as neglected, the roads are broken down, and their houses are in substandard conditions, which present health hazards to them and to their newborns. Within a sub-theme of community safety, women express how the police system mistreats community members and that the shootings in their neighborhood make them feel unsafe and destroy their sense of safety. From economy point of view, their neighborhoods are viewed as disinvested in terms of grocery stores and small businesses.
With the complexities surrounding the issue of infant mortality, current maternal and child health endeavors are adopting a more integrated approach to tackle the unacceptable infant mortality rates. We are shifting from a healthcare approach, the one which focuses on prenatal care, healthcare accessibility, and maternal behaviors, to a more collective approach in which non-traditional risk factors are considered. However, due to certain geographical differences in the distribution of infant mortality, it is important to identify what these risk factors are and who are the people we need to get on board in order to tackle these issues involving all possible sectors of influence. This research was funded by the Missouri Foundation of Health in an effort to identify new partners for a collective impact targeted at the reduction of infant mortality. From the narratives of women who live in disadvantaged urban areas of the city of St. Louis, 14 non-traditional partners like schools, churches, police, media, community elected officials, etc. are identified. To give an example, this is how women framed their needs and conveyed who can actually do something about it to help them. The first picture shown here underscores the need for stringent government regulations regarding household waste disposal. On the second picture here, I would like to quote the exact words of the woman who clicked this image. She said, "This is condemned house which has fell in. It has yet to be boarded up. Kids are gunned down while sitting on these types of Porsches. City doesn't come out to the county to help. The alderman just sits in the office. Tear down the house, fix street, light pole. The alley should be cleaned and sanitized." As it is said that a picture is worth 1,000 words, these pictures taken by the women are a clear proof that there is a dire need for such collaboration in communities. This is certainly a call for building an all-inclusive partnership with non-traditional sectors in the community that would promise a powerful dynamism to adequately address the high infant mortality rate among infants in the urban areas of the city of St. Louis.
Through pictures and stories, women have supported the idea that it is upstream factors that affect whether or not babies survive or thrive in their communities. Some of the sub-themes of environment that women identified have also been documented as the determinant of infant health outcome in several studies. However, what's powerful about photo voice is that we can directly see those issues through the lenses of lived experiences as women see them and live them. Now that we covered how researchers and women see the environment, we can come back to our proverb and ask, who has the best part of the story? Is it researchers or women? With our data, we cannot answer the questions, but a small kappa agreement between themes assigned by women versus those assigned by researchers may be an indication of a differential perception of non-traditional determinants of the survival of infants between the women and the outsiders. In this case, outsiders could be researchers or anyone else who doesn't live the same experiences. Therefore, it is important that the outlook of women be brought to the table of discussion because they may bring a critical insight in the discussion as of where intervention are needed the most and who we could be engaging to reverse the trend in infant mortality in urban areas of the city of St. Louis. Now, returning back to our photo voice impact model we talked about earlier in this presentation, we are using the findings of this research to raise awareness in the local community about non-traditional issues that women portrayed as barrier to better health of them as mothers and to the survival of babies in their community. We created a documentary film that documented women's stories and discussions of these pressing issues in their community, and we are using it to share these stories to the local community. We also printed an exhibition of 28 main pictures, and we are looking for showcase opportunity in the community so people from all sectors and the policy makers can see how women think of the contribution of the environment to the unacceptable high infant mortality in urban areas of the city of St. Louis, the state of Missouri in the United States. Before we conclude our presentation, we would like to thank the Missouri Foundation of Health who funded this work and the women who shared their stories and experiences through photographs.